In this video, I want to talk about healthcare in Costa Rica and the Costa Rican Caja system. This is a cornerstone of life for residents in this tropical paradise, and anybody interested in relocating to Costa Rica or getting residency in Costa Rica is going to be interested to understand how this Caja system works. So the Caja Costarricense de Seguro Social, Social Security, was established in 1941, and basically it's Costa Rica's universal public healthcare system, providing comprehensive care to over 90% of the population through a network of 30 plus hospitals, 250 clinics, and what's called EBAIS primary care teams that go to sort of more remote areas. For foreigners, enrolling in Caja is mandatory to obtain and maintain your residency. That's why it's so important to understand it as a resident of Costa Rica, is because it's literally mandatory to participate and to pay into this system. This is actually pretty unique in the world of residencies in Latin America, where Costa Rica is the only country in Latin America where it's not optional and you're basically forced to pay into the healthcare system. The only other country I can think of is Italy, but even that one's optional, where you can pay like $2,000 a year to get access to the public healthcare system in Italy as a resident. So long story short, this is the only country where it's mandatory. So if you want to get residency in Costa Rica, you want to live in Costa Rica, it's very important that you understand this system, okay? I've made a video in the past about the DMEX card, the DIMEX card, which is basically your resident ID card in Costa Rica. And it requires active Caja payments, and the Caja and the DMEX are integrated. In 2025, there's been digital upgrades like online payment portals and expanded rural access. And this system remains pretty good worldwide, ranked 36th by the World Health Organization, the WHO, in terms of Costa Rica's healthcare system and how it stacks up. So this video will break down what the Caja is, its benefits, who qualifies, the payment and enrollment process step by step, validity, maintenance, potential drawbacks, and some practical tips to navigate it all. All information is updated for 2025 based on official sources and anecdotes from expats that we know and our team of lawyers in the country. But of course, regulations can change, so always consult the government websites as well. And of course, book a consultation with an immigration expert that has experience. By the way, MyLatinLife, we're a full-scale immigration consultancy. We can help you get residency in Costa Rica and help you with all aspects of relocation to Costa Rica. There's a link in the description to book a call with us. If you want to speak to us right away, you could be speaking to us as early as this week. Link in the description to book a call with us to build a custom game plan, weigh your options, and ultimately put that residency and citizenship in your hands. So moving on with the video, the Caja system, which is spelled CAJA, formerly the Costa Rican Social Security Fund, is a universal healthcare platform and program funded by mandatory contributions from employees, employers, and residents, covering everything from checkups to surgeries. It's rooted in Costa Rica's constitutional right to health, ensuring access for all legal residents, including expats, without discrimination for pre-existing conditions, which is pretty good. The system operates on a solidarity model, which basically means pooling funds from payroll taxes, retiree pensions, and luxury goods taxes to serve everyone, including low-income groups, mothers, children, indigenous communities, and people with disabilities. EBAIS teams, which I mentioned earlier, basically consist of doctors, nurses, and public health workers that deliver primary care, and they focus on preventative health as well. And overall, it is a pretty good system. Healthcare in Costa Rica, life expectancy is among the highest in Latin America at around 80 years. Costa Rica even famously has a blue zone, which is with the centenarians, people that live to over 100 years old. I think that's in the Nicosa region of Costa Rica. And for expats, Caja enrollment ties directly to residency, requiring a DMEX application and offers affordable care that rivals private systems in cost and quality. There's also the digital platform of the Caja, which is called the EDUS, the EDUS, which unifies healthcare records across facilities, enhancing efficiency and access. So that when you go to one hospital and then you go to another hospital, they have a universal record system. The benefits of Caja and its payment system are a major draw for residents in 2025, especially those with pre-existing conditions. It provides 100% coverage for medical procedures, hospital stays, prescription drugs, dental care, and emergency services, with no copays or deductibles at the point of service. This includes complex treatments like cancer care or knee replacements, often at a fraction of U.S. costs. Medical tourism thrives here, with over 70,000 visitors annually seeking care. Although those people are primarily going to the private hospitals, there's a lot of demand, there's a lot of high quality doctors, and overall, it's a complementary system, the public and the private system. As a resident of Costa Rica, paying into the Caja, you'll have access to a network of 30 public hospitals, including specialized facilities like the Hospital Nacional de Niños, the Children's Hospital, as well as those 1,000 EBAIS clinics that we mentioned before, ensuring care even in rural areas. Preventative programs like vaccinations and cancer screenings reduce chronic disease rates, with Costa Rica reporting lower obesity than the US. It's only 26% obesity compared to the US's 42%. For expats, Caja means affordable healthcare. Monthly contributions are income-based, covering entire families, including dependents. It also supports residency compliance, unlocking DMEX benefits like banking and property ownership. In 2025, Caja's performance agreements ensure accountability, with 260 annual metrics that they're tracking, like quality, coverage, satisfaction, reducing physician absenteeism, and improving outcomes. So who qualifies for Caja and its healthcare system? All legal residents with a DMEX card, citizens, temporary residents, or permanent residents must enroll, as mandated by immigration law since 2010. So this is nothing new, and this includes expats, workers, retirees, and their dependents, so spouses, children under 25, or disabled. And for temporary residents, this covers all visa classes like the pensionado, the rentista, and the inversionista, the investor visa, so all residency types. No minimum income is required, but contributions are calculated based on declared income from residency applications. Undocumented immigrants can access emergency care, and certain groups like mothers and indigenous people get free services regardless of status. In 2025, over 200,000 expats are enrolled, with 70% from the US, Canada, and Europe, drawn by low costs and quality. Exclusions are very rare, but non-residents, meaning tourists, need private insurance for non-emergency care. No criminal background checks or health checks are needed for Caja, just residency approval. Now let's walk through the Caja payment and enrollment process step by step. This gets a little bit complex, so we're just going to do the basics, and if anyone in the comments wants to expand anecdotally upon the payment system, then feel free to do so. And in our consultations and speaking with our team of Costa Rican lawyers, we can go into more detail. But there's ways to essentially reduce what you're paying into the Caja, if that's kind of your goal, by reducing your income, because it is tied to income. So step one is you obtain your residency approval. You secure temporary or permanent residency via the DGME with your passport, your apostille birth certificate, criminal record check, your income proof, etc. and then you get your resolution document. Once you have that, then step 2 is you gather your Caja documents. You'll need your residency resolution, your DMEX application receipt if the card's not yet issued, your passport, your proof of address like a utility bill or lease, and an income documentation as well, similar to residency. Step 3 is you'll visit a Caja office. There's over 100 offices nationwide, and you can locate your nearest office. You'll submit your documents in person, though some offices allow online pre-registration via the Caja portal. And if you're intimidated about going to a government office where they only speak Spanish, we can have our team go with you to the appointment and help you sign up to the Caja system, and it's going to significantly smooth this process. Step 4, you'll complete an interview. The Caja officer assesses your income for the residency application to calculate your contributions, ranging from 7 to 18% of declared income, adjusted for deductions like taxes or medical expenses. Couples can enroll under one income. Step 5, you make the first payment. Pay at a bank such as Banco de Costa Rica, or pay online via the SINPE or at the Caja office, and then monthly thereafter. You'll receive a receipt and an appointment card with your healthcare validity date matching your DMEX. Step 6, access services. Register at your local EBAIS for checkups, prescriptions, or referrals to hospitals. Your DMEX finalizes once Caja enrollment is confirmed, collected at a post office. The process is straightforward but requires Spanish proficiency or a translator, especially for those rural offices. Caja enrollment is valid as long as you maintain residency and your monthly payments, aligning with your DMEX, which is often 2 years for temporary or 3 to 5 for permanent residents. If you miss payments, your DMEX renewal could be blocked, so you'd have trouble renewing your card. In 2025, online payment portals and autopay options simplify compliance, with reminders sent via email or SMS. After 3 years of temporary residency, 2 or 3 years of temporary residency, apply for permanent residency, reducing presence requirements and maintaining Caja indefinitely. There are also certain residency paths that go to immediate permanent residency, such as having a child born in Costa Rica. Citizenship is after 7 years, typically, or after 2 years for spouses of Costa Ricans. We'll do a whole other video on citizenship in Costa Rica because there are accelerated timelines for different people. There are preferred nationalities for other Latinos, or if you have a kid in the country or a spouse. And if you have none of those, if you're just, American, Canadian retiree, you're typically looking at a 7-year path to citizenship. Here are some practical tips for navigating the Caja payments in the healthcare system in 2025. First, confirm your residency details. Match your income declarations to avoid overpayments. Second, leverage those digital tools for ease of use. Third, hire a translator or agent. Typically, our lawyer will assist with all the Spanish forms and even accompany you to your appointments. Fourth, choose your EBAIS wisely. Urban clinics could have longer or shorter wait times than the rural clinics, depending. Fifth, maintain records. Keep your payment receipts for your DMEX renewals. Sixth, supplement with private care. Although in this video, we haven't gone into too much detail about the private system, many expats use private clinics for speed and higher quality, and then they'll use the Caja for prescriptions, saving costs. 7, join expat forums. MyLatinLife, we have a Telegram group called the Central America Enthusiasts that you can join where we talk all things Costa Rica, as well as Panama and the rest of Central America. A few additional notes. In 2025, the Caja's digital health record system, the EDUS, improves coordination, with 85% of clinics integrated. So you might want to ask your clinic if they are integrated into this system, because it's going to make it easier to visit other clinics around the country. Private insurance via INS or international plans complement Caja for faster specialist access. Emergency care is free for all at public hospitals, even tourists, I believe. The system's focus on preventative care keeps Costa Rica's health metrics top tier. The Costa Rica Caja payment and healthcare system is a lifeline for residents, offering world-class care at affordable rates. From universal coverage to seamless residency integration, it's a pura vida essential. You might be wondering about drawbacks from the healthcare system, the Caja system. So wait times for non-emergency procedures like elective surgeries can stretch months or years. That's why some people might opt to use the private healthcare system if they have the resources for certain things. Another drawback, of course, in rural areas, they're going to have fewer specialists, requiring travel to San Jose, the capital, for advanced care. Facilities can definitely vary. Language barriers can definitely exist, though doctors often know English. Bureaucracy can frustrate with lost files or long queues, reported by some expats, which is why it's important to have a really good team in Costa Rica that can help facilitate and make things happen on your behalf. And regarding your payments and exactly how much you're going to have to pay into the system every month, again, it's going to be tied to your visa. If you're on the rentista or pensionado visa, typically it's going to be a percentage of that $2,500 a month or $1,500 a month that you're showing as your independent means. If you're on the inversionista visa, then you might default to a minimum because you might not be showing that monthly income if you, for example, bought property in Costa Rica and you don't really have any local source income. So there's definitely ways to implement some tax efficiency here and lower your monthly payments. So that's the full guide to the Costa Rica Caja payment and healthcare system. If you're enrolling or have tips, please share in the comments. We'd love to hear from you. Give this video a thumbs up if it helped, subscribe to the channel, and check out our other videos on Costa Rica as well as global residencies. And if you're ready to speak to somebody and start making this a reality, there's a link in the description where you can book a call with us to get the process started. Thanks for watching, and until next time.